Welcome to Science Force, where science comes alive.
Hello everyone and a very warm welcome. I'm absolutely thrilled to have you join me for this explainer where we're going to map out the complete, quite frankly fascinating journey of typhoid fever. Today, we're bridging high-level public health concepts with some really precise medical science. So, whether you're just a curious learner or a dedicated medical student, we're going to unpack exactly how this ancient enteric disease operates, step by meticulous step. Let's get right into it. Agenda. Right, let's take a quick look at our agenda. We are charting this invader's journey in 6 parts. 1. The typhoid threat. 2. Meet the invader. 3. Pathogenesis. 4. Symptom timeline in a 3-week timeline. 5. Diagnosis and treatment. 6. Complications and prevention. 1. The typhoid threat. Global health challenge. Starting off with Section 1, the typhoid threat, looking at it as a global health challenge. You see, millions of people are still affected by typhoid every single year. The high-risk areas are primarily regions like India, Pakistan, Bangladesh, parts of Africa, and Southeast Asia. And why is that? Well, because typhoid absolutely thrives wherever access to clean water and proper sanitation is limited. It spreads strictly through what we call the fecal-oral route. This simply means the bacteria moves from an infected person's feces right into the food or water consumed by someone else. Whether it's contaminated drinking water, improperly cooked street food, raw veggies, or just poor hand hygiene, this remains a critical ongoing issue for South Asia and beyond. 2. Meet the invader, the silent saboteur. Now, for the life science and medical students tuning in, here's the clinical profile. The culprit is Salmonella typhi. It's a gram-negative rod-shaped bacillus and it's equipped with these little flagella that make it highly motile, meaning it can move around quite well. But the absolute most crucial detail here, it acts as a facultative intracellular pathogen. To put that in simple terms, it acts exactly like a microscopic Trojan horse. It can actually survive and even multiply completely inside our own immune cells. It cleverly evades our body's natural defense mechanisms so it doesn't get destroyed. And you know, this Trojan horse ability perfectly illustrates a really dangerous phenomenon, the chronic carrier. Think about the famous historical case of Mary Mallon, better known to the world as Typhoid Mary. Some individuals fully recover from the clinical symptoms of typhoid, but they actually continue to harbor the live bacteria, very often hiding safely away right in their gallbladder. They silently shed the bacteria in their feces, spreading the infection to numerous people completely unknowingly, all because they themselves feel perfectly fine. 3. Pathogenesis, how the bacteria invades. Let's look at the exact 6 steps of how the bacteria invades. Let's track this biological break-in step by step. Entry. Entry through the mouth via contaminated food or water. Survival. Our stomach acid is literally designed to kill bacteria, but Salmonella typhi is incredibly resilient. Some of them survive and push right through into the small intestine. Invasion, the critical intestinal invasion. They actually find these highly specialized doors in our intestinal wall called M cells, sitting right in those regions we know as Peyer's patches. The bacteria sneak through these cells, cross the wall, and effectively enter the body's lymphatic tissue. Multiplication. Once they're inside, the invasion really accelerates. Remember that Trojan horse capability? The bacteria get swallowed up by immune cells called macrophages, but instead of dying, they just multiply right inside them, spreading out to the liver, spleen, and the bone marrow. Primary spread, bacteremia, they quietly enter the bloodstream. You won't even know it's happening. It's completely asymptomatic. Secondary spread, bacteremia, after building up this massive army inside your organs, they pour back into the bloodstream all at once. And this is exactly when the clinical disease becomes violently apparent to the patient. Incubation period. So, how long does all of this microscopic maneuvering actually take? This stealthy buildup has an incubation period of anywhere from 6 to 30 days, averaging about 1 to 2 weeks. The exact time simply depends on how much bacteria you ingested in the first place, and of course, the current strength of your immune system. 4. Symptom timeline. The body fights back. Let's move right into section 4, symptoms. Here's a 3-week timeline of how the body fights back. We can actually track these clinical manifestations quite clearly week by week. Week 1, the patient experiences a slowly rising high fever, perhaps reaching 40 degrees Celsius, accompanied by fatigue, muscle aches, and a really dry cough. Week 2, the fever doesn't just rise, it becomes persistent and continuous. This is where the intense gastrointestinal clashes begin, along with a noticeable enlargement of the liver and spleen. Adult patients frequently face severe constipation, whereas pediatric patients, the children, are much more likely to experience diarrhea. It's a key distinction to keep in mind. Rose spots. Also, during that second week, doctors might look for a very specific vivid visual cue on the patient's skin called rose spots. They're these small pinkish red spots that pop up on the chest or abdomen, though usually just in a minority of patients. If you press on these colorful spots, they actually fade or blanch under the pressure before disappearing completely within a few days. Week 3, if left untreated, we enter the highly dangerous week 3. The patient falls into extreme weakness, a delirious state, and suffers severe, potentially fatal intestinal damage. 5. Diagnosis and treatment, the counterattack. So, the crucial point we arrive at is how do we properly identify and stop this invader once these terrible symptoms start? Let's explore section 5, diagnosis and treatment, the counterattack. Diagnosis tests. When it comes to diagnosing typhoid, timing is absolutely everything. Blood culture, the strict gold standard during the first week. It's highly specific and tells you exactly what you're dealing with. Bone marrow culture actually remains the most sensitive method overall because it works at any stage of the disease, even if the patient has already started taking antibiotics. Stool culture becomes incredibly useful later stages, especially to identify those chronic carriers we spoke about earlier. Widal test, the traditional test used to measure antibodies in later stages, though doctors have to be a bit cautious with it as it can occasionally give false positives. Treatment strategy. Once properly diagnosed, the medical counterattack has got to be swift. Prompt antibiotic therapy, doctors commonly prescribe medications like ceftriaxone, azithromycin, or cefixime. The exact choice is carefully tailored based on the local antibiotic resistance patterns in that specific community. Supportive care. Antibiotics alone aren't enough. They must be perfectly paired with excellent supportive care, adequate fluid replacement, strict bed rest, and proper fever control. 6. Complications and prevention. Winning the war. Finally, we arrive at our last chapter, section 6, complications and prevention. How do we win the war? Severe complications. If a patient reaches the 3rd week without swift antibiotic treatment, they face terrifying, life-threatening complications. Intestinal hemorrhage. The bacteria can cause bleeding ulcers. Intestinal perforation, even worse, where the bacteria literally create a hole right through the intestine. This is an absolute medical emergency, causing severe abdominal rigidity, rapidly leading to deadly septic shock. Systemic spread. The infection can even spread to the brain, causing meningitis, or to the heart, causing myocarditis. It's incredibly serious. But prevention, my friends, is our absolute strongest shield. Personal hygiene starts with simple, proper personal hygiene, rigorous hand washing, drinking only boiled or purified water, and eating freshly cooked, piping hot food. Community level, proper sanitation and sewage disposal are simply mandatory. Vaccines. We have highly effective vaccines, including conjugate, injectable polysaccharide, and oral live attenuated vaccines. These provide significant necessary protection, especially for travelers and young children living in high-risk endemic regions. Conclusion. Ultimately, this right here is where modern medical science claims a glorious victory. Just look at these numbers. If we simply leave typhoid untreated, the mortality rate is a terrifying 10 to 30%. But with prompt, proper antibiotic treatment, that mortality rate drops dramatically down to less than 1%. It is just a stunning, beautiful testament to the power of proper healthcare. We've mapped the entire journey of this microscopic invader in our explainer today, from its silent entry to the dramatic counterattacks of modern medicine. But I want to leave you with a critical public health question to ponder. With highly effective vaccines and rapid antibiotics so readily available today, what will it truly take for our global community to ensure clean water and sanitation for absolutely everyone and eliminate typhoid fever from the globe forever? Thank you so much for joining me to explore this fascinating topic. Keep questioning, keep learning, and I will see you in our next explainer.
Thank you for watching Science Force.